Good afternoon, everyone. Thank you for joining us. If you don't know, my name is James Blake. I'm a wealth advisor at Brand. Happy that everyone's joining us. We're going to give a little bit of time. When I'm told it takes a little time for Zoom to get everyone in. So we'll be respectful of that and get started here within 30 seconds to a minute. Appreciate everyone being here. All right. Good afternoon, everyone. Thanks for your patience. Once again, if you weren't on before, my name is James Blake. It's an honor for me to be hosting this webinar and also to be introducing these two speakers, their respective leaders in their field. I'm really excited for this topic, excited to hear more about something that's really fascinating to me and really critically important to discuss. That is the intersection between health and wealth. I'm particularly interested in learning more about mental health considerations specifically for affluent families. I believe one of the good outcomes from our collective experience with COVID-19 is really an enhanced awareness of mental health issues and the reduction of any social stigmas surrounding professional treatment and care. I believe in my heart that money can be a powerful tool for good in your family, but I do believe it's rendered useless, or worse, I think it can become an accelerant for bad outcomes if mental health issues are not recognized and addressed. With that as a table set, my first introduction is to John Samuels. He's the founder and CEO of Wellworth. John has more than 2 decades of senior leadership experience in the healthcare sector, including very impactful roles at Long Island Jewish Medical Center and Mount Sinai Beth Israel. You can learn more about John's wisdom from his contributions to Forbes and a family office publication named Crane Currency. His company, Wellworth, is a national healthcare advisory firm based in New York. They began with a mission: help people navigate a broken healthcare system. Money has a plan, so should health. That is the alignment of wellness and financial security you will be greeted with when you go to their website, wellworthadvisors.com. Brand AMG's connection to Wellworth allows them to advise our team and our clients on critical, complex healthcare issues. They have a wide range of expertise across every dimension of care. Their staff and network of connections include physicians, healthcare administrators, and nursing professionals. And John is joined in this conversation by Dr. James Flowers of J. Flowers Health Institute, an expert and leader in the fields of chronic pain, pain recovery, and addiction. With his remarkable career and exceptional reputation in the medical and clinical community, Dr. Flowers is uniquely qualified to share his wisdom regarding mental health and, importantly, the pathways to successful recovery. Please join me in welcoming these two distinguishing men to our program. Before I hand the presentation over, I want one housekeeping item I'd like to cover is regarding questions. Zoom has a little bit of an issue lately of Q&A, so we're going to use the chat section at the bottom of your screen. I will do my best to monitor those throughout the presentation. If there's anything that I think is pertinent to what we're actually talking about, I have been given the green light to interrupt the speaker to make this a little bit more interactive. If I kind of aren't able to, and we will still have about 10 to 15 minutes at the end for Q&A that we'll try to address any specific clinical questions. We still want you to reach out. We still want to connect you with the appropriate people. We'll probably just do it on a really more sensitive case-by-case basis. But without further ado, John, it's all yours.
James, thank you for the kind introduction. Wellworth is honored to have this wonderful relationship with Brand, and are available and accessible to your team and your families at all times to help support healthcare. And thank you for your advocacy and allowing your voice to be heard about what's happening in mental health. And Dr. Flowers and I have committed decades of our lives, especially Dr. Flowers, to addressing and supporting the urgent and critical mental health needs of individuals, especially affluent individuals. And only with your support are we able to communicate important messages like this. So we're truly grateful. You mentioned COVID and Dr. Flowers. What are we seeing in this post-COVID world about mental health and substance abuse from your perspective as a clinician, as a leader, and as a voice in this field?
Sure. First of all, I want to thank you, John, for inviting me on the call. And James, thank you. And everybody, thanks for having me here today. I really appreciate it. And I hope what John and I have to offer today is some help. And we're certainly both available for any questions and concerns you guys have. You know, COVID, uh, we're kind of on this other side of COVID, but yet we're not on this other side of COVID because what we're seeing is long-term post-COVID effects, and we see a lot of it. We're seeing big waves, you know, a persistent baseline since COVID of constant generalized anxiety disorders. We're seeing significant sleep disruption continuing, not always dramatic, but a chronic sleep disruption we see. Second, we're seeing a marked rise in burnout, a feeling of demoralization because of just the many changes in our families. The divorce rate throughout COVID doubled to a huge number. Families had a lot of difficulty making it through COVID. And very high achieving in every family, but especially in high achieving families and adults, people are still performing. I call it a functional impairment without an obvious crisis. So in other words, people are continuing to function, but just have a cloud around them. And it can be in the form of anxiety. It can be in the form of grief. It can be in the form of difficult post-COVID symptoms and a lot of medical problems that we did not see prior to COVID. So we're seeing a lot of medical, a lot of substance abuse, and a lot of mental health difficulties that continued and popped up during COVID.
Dr. Flowers, let me, I have a kind of a burning follow-up question, but I'm going to ask that in context to the next question. What shows up differently in high-performing, high-net-worth families who we all work with? And, when I think about that, I also think about, from a follow-up question thought is, what are some of the things people should be looking for? Every year Harvard does something between real memory loss and normal versus not normal. Where does that line get drawn?
Sure. We'll talk about what shows up differently in what I call high performing, high net worth families. And I think it's often less about access to healthcare and it's more about the complexity of healthcare. In our country and really around the world, people tend to be treated in the best institutions and any other institution in silos. And you have a family practice physician who may even be a concierge physician. And then you have physical therapy and you have your orthopedist and your pain docs and all of these other providers that we're seeing as we age. And those physicians and ancillary providers are not discussing the cases with each other. And it complicates the overall medical care. It lessens the quality of medical care, quite frankly. Even in the best concierge practices, we're seeing a siloed approach to it. So we're seeing a lot of high functioning masking. Also, the person can still lead, invest, parent, travel, and problems go unaddressed a lot longer. Families delay care that I've seen because they fear exposure. They don't want anyone, they don't want to be in the news. So they feel like it's an increased risk if they go to a healthcare provider, such as a mental health, psychiatry, or addiction medicine. And also system issues, family roles, enabling dynamics, and rescue dynamics we're seeing in high net worth families because they inadvertently want to keep the symptoms in place and not have them go outside where other people see it. Those families are inundated with options in healthcare. The issue is we want to look at and we want to talk to families about a more collaborative approach than a siloed approach. So looking at programs that offer many things under one roof. Okay. Sometimes the symptom just isn't the problem. It's the signal, right? So yeah.
And what I find interesting about that is, having worked in emergency medicine and being in the ER, patients are treated by teams. Radiology's there,
Yep.
the nursing team is there, the pain team comes, the primary care team comes, psychiatry, everyone, the team comes, and then you leave and you go back to the community, and you're on your own, and there's none of that, and so having addressing treatment as a team is something that's so fundamental to to us who grew up in healthcare, and
Sure.
and bringing that up as a point is really super interesting.
Yeah, I think it's critical to work as a team and have a collaborative approach. And as we grow older and we have our aging grandparents, we have our aging parents, and even adult children who need more healthcare than they typically needed. And doing it in a collaborative mode is going to get people so much further and so much better results, John.
Yeah. And by the way, and there's a question we're going to bring up. By the way, it's not just the team functioning, as you said, it's also who's on the team.
That's right.
Are there 3 team members or are there 12 team members? So I think that's critically important. I have a question here. I'm going to read. Can you speak about technology, COVID relationships with any addiction issues in younger people's whose screen time exploded during the crisis? Now, I know this, right? My kids and the American Academy of Pediatrics say don't have more than X screen time for XYZ year olds. And then COVID came and it was like everything's thrown out the window.
Yeah, absolutely. There's one name everyone on this Zoom should write down, and his name is Dr. Don Grant, Grant. Don is a clinical psychologist in the Los Angeles area, and he lectures all over the United States, has a YouTube channel, and huge on social media. And he is the leading expert in mental health on exactly what this question is. We've seen an explosion in electronic use, right? And electronic addiction. It is a real thing. It's not in what we call the DSM-5, which is our diagnostic and statistical manual for treating mental health and anxiety and things like that in addiction. But it should be, and it probably will be at the next edition. It is a huge problem in this country, and Don Grant is a leading voice in it. He has many published articles online, and he's amazing. I personally am not an expert in the addiction piece of electronics. I don't have children. I have 3 dogs, John, but I know you do, and we see it all the time. My team treats it often in the adolescent community, and it's a huge problem. And as far as treatment, I always pick up the phone or email Don Grant, Dr. Grant in Los Angeles, and he is connected all over the country and will connect us with the right people.
And that's super helpful. Like, who do you see for what, and who are the leaders? And that's really critical. I'm gonna make a comment about that. Just in general, the other piece to that is there's the addiction side, but there's also the side that people aren't learning all these other skills.
Sure.
Because they're spending so much time doing this. So it's not only addiction where there's a crisis, but there's a loss of something else, right? And I think that, kids who are in 4th grade should actually be in 3rd grade because they didn't develop some of those social skills and onward for generations.
And we see young adults who are gamers who go home from school or even miss school, and they shut their bedroom door and they're in there until bedtime gaming, not doing their homework, not doing other things, and they're losing out on a significant amount of socialization. So one huge thing that we're seeing that Don Grant talks about all the time is the inability to function in public, the inability to create friendships and lasting friendships because they're addicted to that screen and they're gaming all day and all night and all weekend long.
Right.
And the social issue is almost bigger than the addiction issue.
Yeah, the opportunity loss
Yeah,
around development, around child development.
sure.
Okay, thank you. And please keep the questions coming. We're here for you. What do you see as new and emerging treatments in mental health and substance use?
Sure. What I would call something precision matching, right? I believe in mental health and mental health treatment, addiction treatment, traditional treatment. You go to a program and everyone, even though they say it's not a cookie cutter program, they tend to be cookie cutter programs, and everyone is thrown into a group and everybody pretty much talks about the same thing. And you get about 5 minutes to talk about your issue, and then everybody else gets the rest of that hour. And so what I'm seeing now is there are a few programs around the country that are doing precision one-on-one treatment, not in a group setting, right? They're looking at new technologies that are out there. One is TMS therapy for intractable depression. So neuromodulation is what it's called, and transcranial magnetic stimulation. It's the new version of a very effective treatment and non-invasive treatment of what the old ECT treatment is for severe depression and also for chronic pain and PTSD. It's a stimulation, and they use it for OCD. They use it for chronic pain, for anxiety. It's an incredible tool used on the right patient. Medication advances for addiction. We're seeing improved protocols around cravings, right? Even I remember 2 years ago, year and a half, 2 years ago, I was sitting with a psychiatry colleague, and he said, he's also a psychiatric weight loss, boarded in psychiatric weight loss as well. And he was talking about GLP-1. And he said, it is the strangest thing. This is like 2 years ago, year and a half, 2 years ago. And he said, I'm seeing a lot of my patients stop drinking, and they're not craving like even having a glass of wine at dinner. And so he and I started having this conversation when no one was really talking about this. And now today we're seeing GLP-1 being used in addiction medicine to stop cravings for sugar,
Yeah.
right? Which
Yeah.
stops craving for alcohol. So we're seeing things like that. We're seeing digital therapeutic and measurement-based care using more validated skills. We're seeing a lot of sleep tracking devices, making sure that people are getting the proper amount of sleep and knowing how many hours of sleep each individual needs. Some people need 8 hours. Some people only need 4 or 5 hours. Everyone is different. Old school medicine is everybody needs 8 hours of sleep. That's not true. We're all unique. But what's important is to know what we require. So we look at that. We're using biomarkers, structured follow-ups to adjust treatments and medications that are appropriate. And then another big one, two other big ones really, would be trauma-informed therapy of evolving beyond traditional talk therapy, skills training, somatic regulation. And then another one used in the right setting by an expert is something called ketamine-assisted therapy. It has to be in selective cases only, and it needs to be integrated in psychotherapy. Everybody hears about Matthew Perry dying from a ketamine overdose, and he did die from a ketamine overdose. But if you look who prescribed it, it was a group of unscrupulous, money-grabbing physicians who would give a movie star anything he wanted, right? And we need to let that side of it go and understand that ketamine can be an incredibly helpful drug if it's dosed at the exactly right dosage and supervised by psychotherapy assisted treatment. So we're seeing things like that.
These things are super exciting, and there are sources you use, conferences, journals, PubMed, British Medical Journal, whatever you use clinically to find this. Where do families find credible guidance instead of Google Medicine or Chat GPT.
Or as we all call it, Dr. Google, right? Don't even I find myself sometimes on Google and Chat GPT looking at different things and
Yeah.
comparing, but we really all need to stay away from it when it comes to it and go to the experts. But you know, and you're right, healthcare professionals have our professional journals. We have our conferences for all of the updated technologies and treatment modalities, but how can families find it? The number one way, and this is not an advertisement to anyone by any means, but it's working with this gentleman right here and his company. That's what you guys do, John, is you help families find the right spot and educate families on technologies and connect them with the right people. So there's a million case managers out there, but you've got to be careful with who you're working with. I am shocked, still shocked in 2026 that a mother of high wealth means today, mothers and fathers and sisters and brothers will say, my sister, my brother, my husband, or my wife is an alcoholic, and I had no idea what to do or where to go.
Yeah. Yeah.
I had no resource, right? And so working with teams like yours, John, is so important. Working with case managers to find the right treatment, and not using Google or
Yeah.
Chat.
Well, yeah. And obviously, I wasn't asking you that for a plug, but let me say this.
No, you were not.
The same way someone walks into an advisor's office, right?
Yep.
And, says, I think I need help with XYZ investments and the stocks are this and my taxes this. And the advisor looks at it and says, no, that's not your issue. It's this. So having an expert figure out this is what's going on, because obviously those who aren't experts don't have the skills to do that. Let me switch topics for a minute and talk about longevity. Longevity's been in the news a lot. How longevity and health span intersect with mental well-being. What are some of your thoughts on that?
Well, longevity is one of these things that is, we're seeing more and more of it every single day. I believe in it. I think it's important. I think you have to, again, find the right provider when you're looking at longevity experts, and make sure that you understand their backgrounds and how long they've been working in longevity. Did they take a 2-day course on a weekend at a longevity conference and then go hang a shingle and say, I'm a longevity expert, which, by the way, happens every day? Or are they experienced and they've been doing it for 8, 10, 15, 20 years? Longevity and mental health are deeply linked because our brain is an organ, right? The pillars of our health scan: sleep, movement, nutrition, inflammation, stress physiology, social connections. They're all the pillars of physical and emotional stability, cognitive performance. We've got to look at that. So when we're treating mental health seriously, we're also protecting our cognition, our cardiovascular health, and long-term functioning. So that mind, body, spirit approach and finding the right person to treat all of that together. And for high performers, we frame it as mental health being a performance and risk management strategy, not just symptom relief. So a longevity expert can help us live longer, healthier lives. We've just got to find the right provider to do that. And working with your concierge, typically, I see a concierge physician, and he has connected me and several of my patients with longevity experts around the country.
Yeah, and I cannot imagine, and you mentioned mental health and physical health, and could you talk more about that relationship clinically? To me, if someone has a mental health challenge, I want to find out who their primary care physician is and when they had their last annual exam, and do they have the right health insurance for all these things. But how you view that relationship clinically?
Well, I view it, first of all, inseparably, right? They are inseparable. our brain and our bodies, old school medicine, right? My grandfather was a general surgeon and practiced until he was 95 years old, and he passed away 30 years ago. And they did not look at the mind and body as the same. They looked at the mind as psychiatric, and it doesn't have anything to do with the body, right? And the body really didn't have anything to do with the mind. And they were real strict on that. You know, when I finished my fellowship 32 years ago, talking to an orthopedic surgeon about the mind-body connection, they would laugh at you. Today, we all realize that they're inseparable. If something is wrong with our body, medically or even somatically, our minds are going to be affected, right? Whether it's anxiety, whether it's fear, chronic pain patients have grief, they have long-term pain and sleep performance issues. They really begin to go into something called helplessness, a state of helplessness, a state of grief and trauma. And then what happens is our body then reacts to the brain. And it's like a ping pong table going back and forth. The worse medically the body is, the more difficult our brain is going to experience life. And we're going to go through stress and trauma. So when treating that, number one, you have to treat the body and the mind as one, right? You cannot just address just one. And when you're working on it yourself, you have to understand going to a physician with a chronic medical problem, you also need to see a therapist who understands health psychology.
Thank you. And what I find, you know, I spent a lot of time in geriatrics, and in a nursing home, a patient, a resident who is doing fine and okay one day and cognitively intact, and the next day not, and
Right.
disoriented and confused. We always thought the same thing initially, UTI,
Right.
because we know the relationship, and that's one of hundreds and hundreds of different ways those things interact, and only those inside healthcare like you understand that.
Yeah. Yeah, exactly right. And it's so interesting in my practice when you see someone who comes into a practice believing, their family believing that, if, for example, a female patient, right, has severe depression, has fibromyalgia, has mental health concerns, who every one of my patients, I have them see a gynecologist, and they have to see her during treatment with me no matter what. It is unbelievable how many conversations I've had with patients and the gynecologist together who say, issue solved, right? This hormones are balanced, and guess what? The mental side takes care of itself. We can't separate those two, and we've got to look at the total body. And again, going back to that collaboration, you know, I have every one of my patients even see an ophthalmologist, because it's so important to look at every part of our body. And
Right.
yeah, so
It's like teeth and aging. How often in the community do you think primary care doctors see something that is primarily shown as physical health, but they should be referring to mental health?
unfortunately, every day.
Every day.
Every day.
Right.
I work with many, and I have many friends that are primary care physicians, and at least today, they're recognizing that they need to do a deeper level of work, right? Typically, again, that primary care doc, you'd go in and give them a list of symptoms, and they'd give you a prescription, or they'd give you an x-ray, or, you know, whatever they needed to do, or referral, and then they'd kind of forget about it until they saw you again. And now today, primary care physicians at least are realizing, you know what, this may be something other than physical, or let me partner with a therapist and see if there's something mental going on, emotionally going on. And but that's genuinely, John, only in the last even 2 to 3 years that physicians of any kind started looking at it and realizing, wow, I have got to partner with a psychologist, a psychiatrist, or other mental health provider to look at every component of this person to make sure I'm not missing anything or misdiagnosing a physical issue and it's really a mental health issue that can be easily solved, or vice versa, a mental health issue being a medical issue.
It's interesting, and we know each other. For those in the audience, we've had these discussions, we've shared patients. My grandfather was also a primary care doctor. He went door to door, and that was back in the day when there were 30 subspecialties in medicine, and today there's 160, right?
Yep.
So, we both take the perspective of holistic care. So maybe something in the DNA of that got us to have this kind of thinking. Many of our clients are interested in wellness retreats and how those help, the value of that, and how do you view them in terms of the spectrum around treatment and wellness?
I think, great question. I think wellness retreats are a very valuable reset, a reset button, right? Reduce stimulation over the weekend or even a 5-day retreat. Again, I'm going to talk about sleep, structured sleep patterns during a wellness retreat, movement classes such as yoga and Tai Chi, eating clean, having clean nutrition while you're there, coaching sessions during a wellness retreat, and a space and time to reflect with other people who are around you, whether it's a 3-day or a 5-day or whatever day retreat that people are going to. And I think they're wonderful. However, 3 days and 5 days are not going to solve long-term problems. They're not going to solve trauma. They're not going to solve depression. They're not going to solve anxiety or any of the other medical or psychological or emotional issues going on. I think they are a wonderful reset to go have a respite and then get back into real life. And I send people all the time to retreats, or family members while their loved one is in treatment. It's amazing for a family member to go get a reset at a wellness retreat. But don't think of a wellness retreat as treatment.
Thank you.
Flowers is another question that came through,
I see it, and I think it's a great one. So thank you. So the question is, have you seen any research on money addiction, or within generations, addiction to financial support? And Dr. Flowers, would you that's the question, and I'm wondering, does this sort of fit under the category of failure to launch?
Yeah, perfect. Yes, absolutely. We see that all the time. I want a little clarification, John, on the question. So we can I'll certainly talk about failure to launch, but read the question to me one more time.
I don't think it's in the chat.
Oh, did it go?
It says,
I think it's gone.
Have you seen any research on money addiction? Have you seen any research on money addiction, or even within generations, addiction to financial support? It says of parents, but I think like financial support by parents.
You got it. Yes. The short answer is 100% all the time. Longer issue is what John mentioned, is we see failure to launch, and I call that also a failure to launch, whether it's a 21-year-old failure to launch or it's a 55-year-old failure to launch. And we see addiction and money. I recently worked with a billionaire family in Canada who have a 50-year-old son that has never worked a day in his life and is spending $125,000 a week on gambling. And probably if it was reported at 125,000, it was probably 225,000. And we see that even in middle-class families, right? Middle-class families who have means. We see people today whose children are staying home longer, not leaving the nest as early as I left the nest, or a lot of us left our nest, which basically was off to college, and you don't go back home except for visits and Christmas. And you don't go back home to live. But we see a lot of people continuing to live with their parents because they have that addiction to money, and mom and dad are continuing to provide money provide trust to people who are irresponsible and are using money in ways that are detrimental to their long-term health and long-term life, I believe. So,
And I believe, I think that for a lot of these things, there's a fine line. There's a fine line between somebody who likes to have the family money and is doing fine, and somebody who has an addiction to it.
sure.
And it's preventing other parts of their lives.
Mhm.
And I would encourage those listening, if they don't know where the person sits on those two things, to find someone to ask, an expert to ask that question to. Maybe this is mental health, or maybe this isn't, because it's a difficult question to answer, and I think a professional should do that.
Yeah, I completely agree, John.
Okay, thank you. That's a great question. I think that's wonderful. I have one last question. Are there any other questions before we wrap up? I don't see anything coming through. I love that last question about that. It's a super interesting topic, about those kind of addiction issues. Addiction, be it to technology, be it to financial, and having somebody else support them. Dr. Flowers, what is one key takeaway you think, that one nugget that people should leave with?
Let me, we'll talk about maybe two.
Okay.
The one thing I would say is I truly believe the fastest way to reduce risk in our healthcare and improve your family outcomes and your family's overall health is to get an accurate diagnosis and a coordinated plan, meaning with a collaborative team. There are concierge physicians and concierge groups now that are multidisciplinary in nature. And it's just my soapbox that one provider does not have time when he has, whether it's 60 patients or 600 patients in their practice, they don't have time to talk to all of the ancillary providers. He can be the hub, but there's a huge spoke of people that need to be included as well. And I think that families need to understand that that our medical health and our mental health are combined, and that we have to treat both at the same time, and that the mental health aspect is equally important to the medical aspect to get a proper diagnosis of what's going on in complex long-term cases. So I think my longer takeaway is just encourage your families to understand medical issues are often intertwined with mental health concerns and mental health problems, and vice versa. And
as evidence in the question, and they're often intertwined with technology and money and so forth. We had a client who had a very severe sleep problem, and looking at where that person should go, there were lots of good sleep doctors who had extensive testing and good reputations and well-trained. And then there's a program that is multidisciplinary, as you say, with pulmonary doctors and internal medicine doctors and psychiatrists and psychologists and therapists and physical therapists, multidisciplinary approach to something like that.
Right. And what I always tell people, the wrong question to ask it, or not really wrong, but the best question to ask is not what program is best, but what's driving the symptoms here, biologically, psychologically, and systemically, right? What is the right next step? And in order to find that right next step, you have to find the right team approach to work on that. So that's my two takeaways.
Wonderful. I don't see any other questions. Dr. Flowers, let me be the first one to thank you for your wisdom, your insight, and your leadership in this field.
Thank you so much. And James, thanks so much for having me. John, appreciate you very much.